And I'm in my early 60s, and my background is I work in a technology company, so I telecommute.
Where's your area of pain, and when did it start, and how did it start, all that kind of stuff?
It started about 10 years ago. It was in the right hip, and it started with a clicking hip. It did noises. The doctor prescribed physiotherapy, and that was, however, interestingly, mostly stretching. So no, nothing like what your method recommends. An ultrasound, they did ultrasound on this. But it got worse and worse and worse. And about
Yeah.
5, 6 years ago, it got really bad. He recommended hip replacement surgery. And I got a second opinion, and that one said the same thing. And they showed me all the things which are wrong in my hip. There is structural damage. The cartilage is worn off, and there is a labral tear, and there's a bone spur, and the angles where the ball and the joint go together, this is like all screwed up and so on. And your favorite, my doctor found also that one of my legs, the right leg, is longer, was a
Yeah.
centimeter longer. He measured it.
Yeah, so you had all sorts of goodies going on in that hip there.
Yeah, indeed. And I couldn't walk anymore. And then however, I was scheduled for hip replacement surgery. I love moving and loved working with weights and resistance, and I couldn't do any of that. I felt also really uncomfortable about the idea of getting an artificial hip joint. That didn't sound right. So now, now I'm back to doing everything I want. So
Great, great. And how long has it been since you started feeling better?
it's actually pretty much after I started reading your book, and we had our first Zoom meeting where you
Yeah.
gave me a lot of good hints, and your observations are so good via Zoom. You said like, oh, I'm doing this or that, and the legs are this or that, so I should do this or that, and I was right on. Maybe needless to say, I canceled that hip replacement surgery. I didn't have that, and instead really started working according to your book, and did the exercises and watched the videos. I got also the supplemental videos, particularly, they were very helpful. And to do it right.
Are you talking about my hip pain home program?
Yeah,
Yeah.
exactly.
Okay.
That.
Yeah.
Exactly. And it feels good, you know.
Yeah.
After those exercises, and especially with the tubes, the hip tube exercise, it feels so good. I mean, it's like a big difference already right there.
Why did you feel that you needed a Zoom consult with me even after you bought that hip pain program? I'm curious about that.
Because it was, when I read the book, I'm not very good with detail. So I read over it, looked at the pictures, did my thing, and was like, yep, it worked some, but then I walked to the videos and I saw more detail, and then I had questions suddenly. And so that's when, and you follow up with people who register with the book. And so I took the opportunity. That made a difference. It was really an important part in the puzzle.
Okay. Was there, what was the information? Because my whole goal with these home programs is to make it so you don't need me. Because I want you to feel independent. So what was the new information that you didn't get in the home program that you got via our Zoom presentation? I'm just kind of curious about that.
Yeah, so there was one was about how to walk properly, with the knees bent and a little bit so the weight forward at the gluteals, and so on, and the way how to feel whether your gluteals are firing or not. And I had my hands in the wrong place, and you saw that. You said, "Oh no, you
That's
need
right.
to up."
Yeah.
And I didn't feel there anything either, because they've now I do. Other thing was, you also mentioned that because of the pain for so long, my body was a little slanted to one side. And you recommended that I put the arm up like this, not all the time, but just here and there shortly, and walk like this, and that would kink it out over time.
Yeah.
And that felt really good too, and that worked really nice.
I'm glad that was meaningful to you. Did we also identify that you had an antiverted femur? Did we talk about that, or retroverted femur?
I
or not?
think, yes, we talked about this, and I think you said antiverted. Yeah.
Yeah, I think I remember you having an antivert, which for those of you listening or watching, that just means that the thigh bone is rotated in. So not everyone's thigh bones are shaped the same. Usually most females' thigh bones are rotated in more, and most males' thigh bones are rotated out more. And so uh, this has some consequences for how you use your legs. For women, because they're rotated in more, you have to get that butt really strong to counter that inward rotation, because your hip joint doesn't like that internal rotation like that. You're going to have nice strong butt to counter all of that internal rotation of your thigh bone. We need to control it. We're not going to stop it completely, but if we can slow it down so it's controlled, then that's much better on the hip joint. Not a hard hammer anymore.
I do a lot of other things different now too, just after your advice, and it might have been the conversation. One is how to just lie down in bed, to have something. Most people put a pillow between their legs. You say it can also be under both legs, interestingly.
Yes.
I never liked any kind of a pillow there extra, but now I'm doing this and got an extra nice, like a thicker pillow, and that works wonders. It's amazing. That helps.
If you were going to teach the people at home to walk correctly, how would you have them go about that?
For me, the key thing was to not use straight legs, which I did before. And instead have just the knee slightly bent, and that automatically seems to do the trick. And I don't even think about it anymore. And the same is true for standing. I always stood with straight legs. That was a habit. And now I don't do this anymore.
Yes, you're absolutely right. I've been a guest on a lot of podcasts, and I always talk about the knee locking as a big source of problems for back, hips, knees, feet, whatever.
It's a small thing. And that was the other interesting thing in the Zoom meeting. The extra little tip you gave was you said, walk on your toes. And I did that, and that activated the gluteals. And you said you cannot be walking on your toes and have straight legs.
What Sylvia is talking about is to activate your butt. If you can go up on your tippy toes and walk around on your tippy toes, what it's going to do is it's going to force your knees to soften, and it's going to force your body to be over your foot at foot strike. And when those two things happen, it turns on your butt muscle. And the turning on the butt muscle is critical for getting rid of hip, SI joint, sciatic, back pain, all sorts of problems. All right. So, and then what you do is you walk around 5 or 10 steps like that, and then you slowly lower your heel down, and your butt should remain turned on. As long as your knee is soft and your body is over your foot at foot strike.
Just the experience of having the gluteals working or not, that was an eye-opener back then, really.
And so I believe that you had something called an anterior femoral glide syndrome. Do you remember us talking about that?
Yes, we were.
And that's in my book too. And what that means is that the femur head is sliding around in that hip socket too much. The main controller of that thigh bone in the hip socket is the butt muscle. And so, and that's why and I can't prove it, but I believe it's that sliding around that has caused a lot of the arthritic change and the labral tear and whatever bone spurs and things like that have occurred in your hip. Like a doctor will send you to physical therapy, and like your physical therapy didn't help you. So they tick that off like, okay, I've tried physical therapy. But I always explain it like, well, if you ate at McDonald's and didn't like it, would you then not like all restaurants? You know, it's the same thing, right? Because there's a huge umbrella of possibilities out there.
Because it really helps. You don't need a surgery. I wish I would have known about it 10 years ago, because then probably the structural damage would have been much less already in my hip. I'm just so grateful that somehow miraculously I came across your book and your method and stuck with it, and because it really helps. Everyone out there who has hip pain needs to do those, or knee pain. or whatever pain, because boy, it's so simple. It's really simple and it works. I'm pain-free. I can walk. I can do weight workouts. I work in the garden. I can do things with my hip. I mean,
it makes it all worthwhile to me to
yeah,
hear you say that. So thank you.
it's really wonderful. Thank you for that.
Oh, my pleasure.